Measuring what matters most to children and their families in their care is one key priority for patient-oriented research. Patient-reported outcome measures and patient-reported experience measures, often called PROMs and PREMs, are one way to do this. How can they be used to improve patient care? This is Pep Talks, the Patient Engagement Podcast. In this episode, we talked to Sumedh Bele about engaging pediatric asthma patients and their families as partners in his PhD project called KidsPRO, which aims to integrate patient-reported outcome measures into routine clinical care. I first asked Sumedh to tell me a little bit about himself.
I am originally from India. Right after completing my high school, actually, I went to China to do my med school. So I completed an MD degree there in China, and then after that, I pursued masters in public health, again in China. In between, I pursued several courses in international health, public health from Europe, like Belgium, Poland, and other places. And from 2016, I started my PhD here at the University of Calgary. And from last year, I joined the patient engagement platform as the assistant director for Southern Alberta region.
How did you find the transition from being a medical doctor in China to being a health researcher here in Canada?
It's a very different experience because one key difference between that I observed between Canada and India, China, or other developing countries is that clinicians there just wear one hat. That means they just do clinical duties. Very few of them are involved in research.
Okay.
But the major difference that I observed here is that a lot of times clinicians here are engaged in research. So for me, when I moved here, I never thought of never thought of going into clinical practice, because I always came up with this. I had this idea, preconceived notion that clinicians are just supposed to do the clinical duties and researchers are supposed to do that. But apparently, after coming here, I've seen that it is different here.
Yeah, fair enough. Yeah. So can you tell us about your PhD project? Like, what is it, and like, what does it involve? All that.
Right. So my PhD project is a KidsPRO project. So I'm working on a project called KidsPRO, and as the name suggests, it's in a pediatric population. So what this project is actually is, in this project, we are trying to assess the feasibility of integrating something called patient-reported outcome measures in routine clinical care. Now, for those listeners who don't know what patient-reported outcome measures are, in short, we call them PROMs, patient-reported outcome measures. So these are the set of questionnaires that are standardized, validated, and developed through rigorous scientific process. And the goal of these questionnaires is to basically extract the perception of patients pertaining to their health condition.
Okay.
So what KidsPRO project aims to do is to try to evaluate if integrating PROMs in routine clinical care can change the way care is delivered right now. The evidence suggests, and most of the evidence is from adult population, it suggests that when PROMs are integrated in routine clinical care, they enhance many things, including health outcomes of the pediatric patients. They also help in reducing the health services utilization. They also enhance the patient, clinician, patient family, clinician family member communication. So there are lots of benefits, but unfortunately, there is this, a wrong notion among medical community. Probably it comes from the paternalistic view that health providers have, is that patient, they don't understand what they are going through, and that's more severe, this kind of paternalistic approach among pediatric population. A lot of pediatricians, they feel that pediatric patients might not know what they are going through, but evidence suggests otherwise. So there are fewer studies, mostly done in European countries, where they try to evaluate the impact of integrating patient-reported outcome measures in routine pediatric clinical care. But in Canada, there is no such systematic inquiry. So KidsPRO is the first project, in fact, the first project to evaluate this. To be specific, for my PhD project, we are going to assess the feasibility and evaluate the role of prompts in asthma care. So our study site is the asthma clinic at Alberta Children's Hospital.
Okay.
Yeah.
So do you want to talk about, because this is a patient engagement podcast, do you want to talk about the role of patients and their families in your project?
Absolutely. That's one of the novel approach that we have taken. And last year, this project actually received two oral presentations at the national level conference, the KidsPRO conference,
Okay.
Canadian Association for Health Services Researchers and Policy Makers, because of this novel approach that we have used. So what we have done in KidsPRO project is that right from the beginning, we engaged pediatric patients and their family members, mostly mothers, as the patient partners. So we have engaged them at different levels, but throughout the project. So we have, and even to start this engagement, what we did was we used some innovative ways, like we created a cartoon-style video called Mission Possible. Recruit these patient partners in our project, and that video, Alberta Health Services liked it very much, and they have put it on their website. Through this video, we recruited 5 pairs of mother and the child. So our youngest partner is 8 years old, and the eldest one is 18 years old. So we have these 5 incredibly engaged children, youth, and their moms as the patient partners. If we talk about the level of engagement, then even for when we conducted systematic review. So systematic review is something that is conducted to see what kind of evidence is available out there in the scientific medical literature, and trying to understand what kind of practices are in what kind of evidence is there. So even in the systematic review for KidsPRO project, we presented the findings of the systematic review to these patient partners, and elicited their opinion. What do they think? And we even included that in the manuscript when we submitted this systematic review for publication in a reputed journal. So that was the level of engagement. After this, the engagement continues. Right now, we just developed the platform, KidsPRO platform, and we are seeking the feedback from these patient partners to ask what kind of what about the user interface? Do they find it difficult to access the website? What about completing questionnaire? How would they like to see the results being shown? What kind of graphs? What kind of colors should those graphs use? All these kind of things. We are taking this patient partner's opinion in refining this KidsPRO system. So it has been a great experience for me as a health services researcher, and it is making our project truly a patient-oriented research project.
Awesome. So like, what kind of unique or novel things do you think that these patient and family partners have brought to your project?
So the first thing, I have mentioned several ways that we have engaged patient family caregivers. Just to give you an example, when we presented the systematic review findings to our patient partners, and we just showed them that the evidence from medical literature shows that most of the studies where they use patient-reported outcome measures in routine clinical care, those studies shows that the number of referrals have increased. So the clinicians, they refer the patient to
Mm.
more type of healthcare providers, which our patient partners kind of disagreed with. They said it doesn't make sense
Mm.
because right now in their eyes, they think that clinicians kind of ask them to do this test shopping. Like they are not
Mm.
sure, so they just like, why don't you do this test? Why don't you go to this? So they thought that having patient-reported outcome measures resolve, the clinician would be able to do proper diagnosis or
Mm.
be able to pinpoint to right intervention, and the number of referrals should decrease. And we have incorporated these findings in the manuscript as well. So this is
Mhm.
just one of the example that a lot of times we, as a health services researchers, we look at results or some things from our own set of notions. But when patients or their family members look at the same things, they bring a different lens. So this is just an example. Now we are seeking their feedback on we are developing the logo for KidsPRO.
Mm.
Again, thought some colors might look good to kids, but actually asking them would make it more attractive to rest of the population that we are aiming to focus through this project.
Yes. So what would you say to people who would be worried about engaging patients as fully as you have? You often hear people worried about, oh, it's going to be a lot of work, or it's going to be so much effort coordinating it. Like, what are some things that you might tell them to look out for, or just some thoughts you have about the particular nature of the work when working with these partners?
Yeah, and I can understand where this comes from. In my capacity as the assistant director for the platform,
Mm-hmm.
I usually consult with a lot of researchers in the province, and a lot of times they consider engaging patients as a kind of barrier or a kind of something a difficult thing to do. But actually, I would say they kind of support you rather than bring an extra burden on you. Plus, when you are doing patient engagement, these patient partners, you don't have to have large number of group. You just need to have few people who you feel comfortable working with. The requirement for patient partners is very different than say patient participants for your project. So you are basically dealing with a small group of people who you kind of choose. You just don't do a random selection, but you kind of choose with who has certain skills. For example, patient partners might require basic ability to deal with basic reading writing abilities, or whatever requirements you have, but a small group of people who you choose to be your patient partner. So that's why I think there shouldn't be any worry.
Mm-hmm.
Also, they bring a different lens, and a lot of times them being present helps you to find some solutions which you can't think on your own.
Mm-hmm.
So I think it's having patient partners is a strength for a project. Plus, even if you are submitting a grant proposal, having patient partners who are properly recognized, whose tasks are outlined clearly, actually strengthens your project.
Mm-hmm. Yeah, so what kind of advice would you give to maybe researchers or even grad students who are looking to get more involved with having patient partners, and maybe even especially kids as patient partners? Like, is there what are the 2 or 3 things that you would tell them that they need to think about?
Yeah. First thing first, don't be afraid of engaging patient partners. We have come across several projects where the projects are actually bench-sized, trying to engage patients, because ultimately the goal of providing health is to cater to the needs of patients. So having patient partners helps you in achieving that goal. That's first thing first. Second, if you want to engage, think with your team. If you are a PI, a principal investigator, or if you are the lead of the study, or even you are just a group member, throw this idea to the team that why don't we engage patients? There are different ways to engage patients. If you don't know how to do patient engagement, we at the Patient Engagement Platform are there to help and to support you. We do consultations with your research teams. We tell how to recruit patient partners. We even help you to make the advertisements through our newly launched website called Albertans for Health Research. We also use social media to help you to recruit patient partners. And third thing, to be specific about pediatric patients, it's a tricky thing because personally, since my project falls in the area of pediatrics, I personally haven't come across any study where they have extensively engaged pediatric patients as partners. But I think it's fun. In the past, I have the experience of being an educator, teaching children of different ages. So for me, it came naturally, probably engaging with patients. But my personal experience is that children or youth really bring a different lens. So instead of thinking them as a barrier, you should identify. You should talk with the pediatricians. And I'm assuming if it's a child health related project, you might have some pediatricians or other child health researchers in your team. A lot of times they have someone in their practice, or they know someone who could be a suitable patient partner. One more thing is that unlike adult population, you always have to get their family members engaged. Also listen to them. That's what we have been doing when we present our findings. It's very interesting to hear their perspectives. And if a project deals with pediatric population, then I think patient engagement would be the first step to bring those findings out in the general population.
Mm-hmm. Yeah, no. So longtime fans of pep talks, and I assume we have thousands or millions even by now, will know that you interviewed Charles Friedman in our first episode. Do you have any thoughts from that conversation, or like about how Albertans and people in general might find themselves involved in these learning health systems?
Right. So yeah, it was it was a true honor to interview Dr. Charles Friedman, and he is the foremost authority on learning health systems. And you might be aware, learning health system is the way where most of the health systems are trying to bring evidence based practice. So my experience during the interview was really good. Dr. Friedman is well aware of, he's based in the University of Michigan, and he's well aware of health system in Canada. And especially answering your question about how can Albertans become more involved in learning health systems. Fortunately, compared to other health systems within Canada, Alberta is the only province with the province-wide healthcare system. Which kind of is a really important thing, because that means whatever evidence is generated within this one health system gets applied throughout the province, or at least there's sharing of information throughout the health system for the province, which might not be the case in other provinces. Second important thing is Alberta Health Services already have several learning health systems. So I'm sure you might have heard, or listeners might have heard, something called strategic clinical networks. Yes. So strategic clinical networks, and I think there are many different, they are based on the different body systems like respiratory, cardiovascular, or maternal and child health, SCNs. So what these SCNs are actually learning health systems. Their mandate is to incorporate first to generate the evidence while the clinicians or the members of SCNs are practicing, generate this evidence and bring back that, analyze the data, whatever they generate, and bring that back in the practice. So SCNs are already working in Alberta, so that means there is excellent ground laid for Albertans to be involved in the research and in learning health system. And learning health system relies on learning health cycle, and learning health cycle basically requires engagement of different types of stakeholders. So the stakeholders would be policymakers, they would be frontline staff, policy, senior administrators, and patient partners. Like patients would be part of these group of stakeholders. So and SCNs are right now doing that. So all the SCNs, as far as I know, in Alberta Health Services have patient advisory groups who advise them. Also, we are strengthening our partnership as the platform with different SCNs. So we would also be providing different support to these SCNs to engage patients. So Albertans have a lot of opportunity, and I'm sure our platform is there. We always advocate for patient engagement. We support researchers. We engage community members through our community coordinator. So we are also trying to act as bridge. So in my opinion, Albertans would be and should be a part of learning health systems, and that's the future. So be ready to be engaged.
Yeah, thanks so much for joining us today.
Yeah, thank you. It was a pleasure. Thanks.
Thanks so much for joining us for this episode of Pep Talks, the Patient Engagement Podcast, brought to you by the Alberta Strategy for Patient-Oriented Research Patient Engagement Platform. Special thanks to Sandra Zielinski and Sadia Ahmed for their co-production. Make sure to subscribe to this podcast wherever you found it, and we hope you'll join us again for more interesting discussions about patient engagement in health research and healthcare.